Sorry, my phone died, so to charge it. All right, washing my hands again. I'm gonna put my gloves on. And spiking and priming, I'm going to and I apologize, this should be on my face. There. Okay, so yours is gonna rip. Mine's just gonna open like this. I'm gonna gently pull this out. There's gonna be an end with a spike, an end that lower locks to the end of the extension. And then there's gonna be a clamp and possibly a clip, okay, depending on your line. So for me, this perpendicular means that it's locked, okay? So I don't have anything, if I spike it, the solution's not gonna go to the end, okay? So my tubing, this has a cap, okay, that's ready to go. I'm gonna look at my bag, open my bag, okay? There's a port again for medication, and then there's a port to be spiked. That port's gonna have something that I pull, okay? And then I'm gonna uncap my spike, okay? And then remember, this is clamped, and then I'm gonna spike it and drive it in there. All right, so when that's there, all right, I'm gonna hang it on my pole. And yours is gonna have a pump with it. All right. And then I'm gonna pinch my chamber. Chamber is gonna be 1/4 to a 1/2 full of fluid. And then I'm gonna slowly unclamp so I could prime my tubing. So remember, the slower you go, the less your bubbles are gonna, less bubbles you're gonna have, okay? So, look at that, I primed it so well, I don't even have any air bubbles, right? Awesome job. All right, so that is actually ready to go and to connect to my patient. All right, so, I'm sorry, before connecting to the patient, you're going to program your pump. All right, so remember your pump is turn it on. If I'm talking about the Laris, turn it on. Okay, you're gonna check. It's gonna ask you what unit you're on. You're gonna say med surge. Is this a new patient? No, same patient. And then it's gonna ask you what solution. So you're gonna choose based on the library, either basic solution or the actual solution from the library. Okay, I don't want that to mess you up. If that happens where I don't have the solution, just pick basic solution. So that part isn't a stopping point for you, okay? So basic solution, anything's gonna ask you for 2 things. Is the rate and the volume. So remember our rate was from the order, 125 milliliters per hour. The volume is your bag minus 10. So this is a 500 ml bag. I'm gonna put the volume as 490, okay? So, boop, 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 boop. Okay, and then I put my clip in there and it's ready to go. So this is already inside the pump. All I gotta do is clean this hub on my patient, okay? And then attach these 2 things, which they're not gonna attach for me. Okay, as a Lura lock system, and then I'm gonna press start. Okay, and that'll be me with my solution. That should take me 10 minutes. Okay, so I apologize. Between, before that, I assumed that you started off with your assessment. So the beginning of this, you should have assessed this IV site for infiltration, redness, swelling. Okay, ask your patient, hey, does this IV hurt you? No? Okay, then I'm gonna start the fluid, okay? So then that way you press start after you've done your assessment. Now, just because I went back and assessed is good. what I'm looking for is before you start your intervention that you're doing your assessment. Okay, that's the nursing process. Oops, your pump broke. You're gonna have to calculate the drip rate based on your drop factor, which is on your tubing, remember, 10 drops per milliliter at 125 is the rate. I want you to deliver that, you know, you're gonna have to calculate drops per minute. Okay, so do that math in advance. You only have two types. There's either 10 or 20 drops per milliliter, okay? And then on your in your book, you're gonna use the formula method or use dimensional analysis to calculate, just like we did in the MAE, okay? The drop rate, right? And then GTTs, we're not gonna sit there and look at the drops falling, but you'll have to calculate and you have to show me your work, okay? So after that, let's say that it's running and it's doing good. I've set the pump. You've calculated a manual infusion, GTTs per minute. I'm gonna put my label. So here, my lactated ringers label. And then here, I'm gonna put my label for my IV tubing. Again, IV tubing, that's the one that's 24 to 48 hours, along with your bag that we have to replace it, okay? All right, that's 10 minutes. The last part, 5 minutes, is the removal. Okay, Mr. Smith, after this bag, we're gonna go ahead and DC your IV because you're ready to go home. Yay, okay. So I undo the IV. This gets disposed of together in the Daniel Sharps in the dirty utility room, okay? This is my IV. I'm going to first remove the tape that's on the extension, okay? And then, of course, excuse me, before I start this, I'm going to inspect the site again, make sure after the infusion we're not infiltrated, redness, swelling, that the site is good, and then I check my order for removal, okay? So removing the IV because you're ready to go home, okay? Demonstrate the removal. So with me, I've taken tons of these alcohol pads, okay? Because what I'm gonna do is, okay, I'm going to be taking off the tegaderm and kind of anchoring my catheter here, okay? But if it's sticky, I'm gonna use an alcohol pad to kind of get around the stickiness of the IV site all the way around. Okay, moving the tegaderm gently so that everything is lifted and I kind of see my catheter tip, but all the tegaderm is off, okay? And then what I'm gonna do is I'm gonna take a gauze and put it over the site. Okay, Mr. Smith, you ready? It's just gonna be a little bit of pressure when I pull this out. Ready? 1, 2, 3. Okay, go ahead and hold that for me, Mr. Smith. I'm gonna take the catheter end. Okay, and I'm gonna inspect that the end of this catheter that I pulled out is intact. Okay, if not, I gotta go and occlude here the tourniquet and troubleshoot something of a broken catheter, okay? Then all of this goes into my Sharps box, okay? And then I'm going to put this in the garbage, clean up my station, and then I'm going to explain that the items to document are that the type of catheter removed, when, where, okay, the time and date, the fact that the patient tolerated it well, and that the catheter was intact. Okay, and then I'm gonna sign it. All right, so that's it. All right, so if you have questions, you can talk to me in about 5 minutes. All right, bye.